So, hello everyone. Today I am with Dr. Ravi Gaur. Dr. Ravi Gaur is a qualified oncopathologist, and as you all know, we'll talk about digital health with Dr. Ravi Gaur as well. And we'll look at various aspects of digital health into diagnostics also. Just because he's a pathologist, he'll be able to shed better light upon that. So, first of all, how are you, sir?
I'm perfectly fine. It's a pleasure meeting you and
It's a
pleasure
pleasure
being
seeing
here
you
at
in
the
person as well.
InnoHEALTH Conference. It was a wonderful event.
Right.
I really
Thank you, sir.
enjoyed the agenda and the topics right here.
Thank you, sir. And so directly start with the first question, not taking much of his time as well, just because he's too busy. So primarily, sir, since our topic is digital health, so what do you think is the future of digital health, or what do you think is the current state of digital health in the era of healthcare?
You know, digital health is definitely arrived. There's no question it is not there. And I think what we were thinking it come 10 years from now, it's already seen. The impact is probably another 5 years are really, really exciting for all digital health providers. Healthcare has always been healthcare providers for that matter. They've been reluctant to utilize digital health services
Right.
because the conventional medicine, conventional people, they always feel they're very happy with what they're doing. Their rigidity exists. So what really happened is in the past, recent past, is like so many various diverse digital health applications and the processes and benefits are visible.
Right.
There's a mindset change which is happening in the senior, you can say, healthcare providers.
Right.
So they are the decision makers.
Right. Of course.
So this is something which is a change in mindset, because these applications have been there since ages. Other industries are adopted some 20 years back,
Right.
but healthcare has come up late.
Right.
Uh, this is some thing we are all looking forward to because it's the most welcome thing, and that's the only way today in our country we can provide healthcare services to the remotest location. Technology can reach, people can't reach at many places.
Right.
Because there is skill shortage, there is
Right.
infrastructure shortage.
Right.
But our technology can reach. Today we are talking about robotic surgeries. Today we are talking about remote diagnostics. Today we are talking about continuous monitoring. I think we are there. I think digital health has arrived. There are challenges, but I'm pretty sure with time, it's very fast the way the technology providers and the healthcare providers are integrating.
Right.
This is going to be a boom in the future.
And this is one lovely integration of all of them together, right?
Absolutely.
Absolutely. So since you talked about diagnostics as well, I'd like to question you one more thing. The new age technology, it is getting into diagnostics, and I've always heard that the diagnostics is always a hinder in treatment, right? So we try to reduce the time as low as we can, but with the integration technology, is it really helping in time reduction and other aspects also? Because time reduction could be seen. Earlier, X-ray were done in 6 7 hours. Today, you can get it in 2 minutes. But is the technology feasible as well for the patients, for the doctor, and everyone else?
See, very right question, relevant question you're asking. Technology does has helped to some extent because, like point of care devices.
Mhm.
Now, if you look at the diagnostics, probably now they're small. Probably in this table like this, you'll have 15 devices and you can get instant results in 1 or 2 minutes.
Right.
That's something required.
Right.
But there are many technologies which is really of no. Even if you get an instant value, nothing can be done.
Right.
So then, what is the point in working with that? So we have to
Right.
be identifying working into technologies which are immediate benefits.
Right.
There are many technologies which is just people are working without realizing that this, and that's where the failure would happen.
Right.
But I think it is helping. But then the second part is helping in improving the quality, because quality is the most important aspect.
Mhm.
And the newer area, because if you look at the diagnostics, our all equipments already had been automated last so many years. They
Mhm.
already had small robots working inside.
Right.
It's already been there. There's nothing really analytical space.
Right.
But it's been applied in the pre-analytical or post-analytical. After sample been collected, how does it reach? How do you track temperature maintenance? A lot of factors.
Right.
And then the results, how the results reach the clinicians. How does the result reach the patient?
Right.
How do you analyze the results?
Right.
And what are the reflex testing? And that's where technology applications are happening. Another important area is digital pathology and histopathology and biopsies.
Mhm.
Over 70% of all cancer diagnosis is done. First primary is biopsy, tissue
Right.
biopsy. And the tissue biopsy, you need all of them rather for that. 80% of need a second opinion, the standard teaching in
Right.
onco-surgery. Have an opinion, but how do you get a second opinion?
Right.
Because they are limited people. Digital pathology, with the whole slide scanners have now come, it actually come into practice. Their slide can be scanned, and it's like a whole scanning is being done, which was already happening in radiology for many years,
Right.
for decades plus.
Right.
Today it's happening in pathology. I can send the real-time image to best of super specialists, to national level, across geography, international. So in my remote village, there is no pathologist. Surgery is happening, maybe shorter pathology exists sometime,
Right.
but no biopsy. How do you report? Use this.
Right.
There is a scanner, slides a scan, and image even can report from a remotest part of Mizoram or Agartala or maybe somewhere Sikkim. You can have the best reporting from Florida, Mayo, or Delhi or Mumbai, wherever it is,
Anywhere
and
in
the
the world.
real time.
Right. In the real
This
time.
is something is very very beneficial,
Right.
but it's expensive. I think with the volume going up, a lot of regulators, new innovators are coming out. They
Right.
want to bring down their pricing. We're trying to make accessible, affordable, and but it will take time to adapt.
Right.
Because adaptability is a question. People they will have to be assured that whatever outputs are being there, they're actually you can say the correct one. So
Right.
validation process is a continuous process. It
Validation
has
is
to
continuous
happen.
process, of course.
This is, I think, evolving. Journey is exciting, and we are all looking forward to it.
So integrating technology into medicine is one thing, and integrating supply chain effectively into management, into hospitals or healthcare is another thing. So do you think integration of supply chain management would reduce this burden on us?
Definitely. Supply chain is what? It was, otherwise, this is what we saw in COVID.
Right.
In our COVID time, there was sudden shortage.
Right.
We don't know what stock is.
Right.
We don't know what's going to come.
Right.
I never knew because I started doing 10 tests, COVID RT-PCR a day, and within a 15 days, I was doing 5,000 tests. I could never imagine the
That's a
scale.
huge
of the
spike.
Spike.
Yeah.
So my reagents, what was to be, I used to procure over 1 month inventory. I was finished in 2 days. Now, how do you predict that?
Right.
I think this is where the supply chain, because you have integrated systems, the vendors, the manufacturers, the clinicians, and the lab. When you have a real-time information, patient samples come, you can actually create. That is one important part. You
Right.
can create stock well. Secondly, I don't have to keep my stock ready for 2 months. Why should I keep it for stock for 3 months?
Right.
Half of 30% might expire.
Mhm.
It reduces my cost. If there is a supply chain integration with the manufacturer and a newer manufacturers, a lot of newer things are coming up.
Right.
How do you get aware of the newer reagents have come, newer equipments have come? We don't know. I think that's definitely helping us out, and it is the healthcare providers for that matter, and they are adopting it very very fast. Even aggregators are working now.
Right. Aggregators are also
Where
working.
if I can procure one as I know a startup, the startup is something we start here, and they procure for 10 hospitals.
Like.
By scale, by volume, prices come down, and they manage.
Right.
It is definitely a big help today.
Right. So moving on from diagnostics to from diagnostic and supply chain to medicine. So how do you think this diagnostics, this effective diagnostics via technology, is going to help in precision medicine?
This is an era of earlier it was personalized medicine, now it's become precision medicine.
Right.
And even I am today we call it personalized diagnostics.
Right.
This all started with the oncology and the cancer. In cancer, we always had, the tumor. Not every tumor has got something mutation.
Right.
The new technologies like NGS sequencing came. We were able to identify what is the mutation happened in this tumor tissue.
Mm-hmm.
Once you know the mutation, which gene is mutated,
Right.
there may be millions of genes,
Right.
but only 10 is mutated and predicted cancer.
Right.
So my drug therapy is
Right.
only for 10 mutated genes.
Right.
So my therapy become absolutely targeted.
Right.
I target that mutated gene. So if you look at this evolution, what has happened is in chemotherapy it's become almost painless.
Right, sir.
It's an OPD procedure now. People go and then it's because and the outcomes are better. So what we're doing is we have a diagnostics, we have medicines, and which genomic or molecular level testing is happening, RNA, DNA, whatever you can say
Right.
that. It is which drug will work better for an individual,
Right.
not for a person like okay, male, female, adult. No, for a X individual, that genomic profile. Those are various other factors. These are the testing patterns, and which will going to work better on the individual. And
Right.
this is where the precision medicine is.
Right.
And I think this is an era is already arrived in oncology. It's already happening in cardiology, and I think we really want to see that. See, example like metformin in diabetes. 60% people respond to metformin, 40% don't respond.
Right.
Why? Sometimes you take a higher dose and keep doing low adjustment and dose adjustment. Maybe you have a genetic mutation where the low dose can work.
Of course.
High dose can create a problem. I think this is now on precision medicine. I think is an era of precision medicine, and we all look forward. I think diagnostic is moving to personalized diagnostics. Medicine is moving to precision medicine,
Right.
and this is where I think the future will be bright. I think outcomes will be better, clinical outcome will be better, and everyone will benefit out of it.
Like we have finally recognized that every body reacts different, so that is why there's a need of precision medicine right now. Sir, since you're an oncologist, there's one more question for you. That is just for the awareness of the public who are hearing us. I have heard that breast cancer is very prevalent among women nowadays, right? So I've also heard that breastfeeding helps, right? So like, what is the exact thing? Is it genetic that is happening, or can this be avoided? Can this be prevented?
You're talking about breast cancer.
Right.
See, two things have happened. Firstly, incidence of breast cancer have increased.
Right.
Now, reason, lifestyle.
Lifestyle.
That's one.
Right.
As such, an early diagnosis. Because I think with time, the diagnostic facilities are available right there. People have become more aware. So they're going back to a doctor, getting investigated earlier.
Right.
Earlier, it was only stage 3, stage 4. Now we see that many of the women, they come in stage 1, stage 0.
Right.
And this is what was happening in the West. 70% of people in the West land up in stage 0, stage 1, which is almost curable. India, it's a reverse. Only 30% come in stage. But today, I think the change is happening. That's where number one, the diagnostics is helping in early diagnosis of the breast cancer.
Right.
Why it is happening? There are lifestyle changes because alcohol, smoking, the sleeping pattern, hormonal imbalances. You can say that the when getting late marriages, because
Right.
if you delay, if the first child is happening after 35 years of age, there is again because there are multiple factors to it.
Right.
And of course, we are all exposed to various stress, obesity,
Right.
pollution,
Right.
radiation.
Right.
So the environment, which is external, and environment, which is internal. Are our habits together.
Right.
They're all getting changed.
Right.
We travel right, left, and center without realizing. Our sleep pattern is disturbed, our body rhythm is disturbed, we have sedentary habits, we eat whatever we want. And the younger generation, the worry is because this disease is now seen in the younger population. Because that's the main worry. Otherwise, it's always about 50 years of age. But today, we can see in 35 years, about 30, 40 years of age.
Right.
I think the answer to this is, I'll always say, be aware, take all, you can say, precautionary measures. Self breast examination is the best answer.
Right.
Every year, after 30 years of age, do your self breast examination once, at least a quarter. Once a year, go back to your doctor. At 40 or 45 years, get a mammogram done and screening done. I think the aim is not, we cannot reduce the incidence, but if you can reduce you can diagnose early, stage 0 and 1, we have reached the cure. Because stage 0 and 1 can be almost 100%.
Curable. Yeah. So that was one piece of advice coming from Dr. Ravi Gaur, and we are like planning to get more of his interviews in the future. But right now, as I said, we are short on time. So this was my time. Thank you, Dr. Ravi, for coming with us
Thank you. My
sharing
pleasure. And
sharing
looking
all this information with us. That was really helpful. Thank you, sir.
Thank you so
It was
much.
great to
Bye-bye.
see you here.
Thank you.
Take care. Stay healthy.